Depression is a common and serious consequence of chronic pain because it interferes with the person's ability to develop effective symptom control strategies and can cause a person to give up. Ted White is such a person. Although he successfully returned to a satisfying life, he almost didn't make it.
I was working for Knott's Berry Farm at the time. I was up in a crane 90 feet in the air, putting up a tent that I'd made to go over one of the rides, and I was leaning out of the crane basket, and when the tent unfolded, well, I had a hold of it, and at the end of it, why, it snapped, and whenever it did, it jerked my back all apart.
Okay. And you ruptured a couple of discs, I understand.
Right, yeah.
Okay. Surgery was recommended, but you didn't want that.
No, I was afraid of it, and I saw several different doctors, and they said it was possible that it would help, but anyone over 40 years old that has a surgery like that, 9 chances out of 10 I wouldn't be able to work or anything.
Okay.
And the third one said that he wouldn't do it as long as I was able to cope with it, you know.
Mm-hmm. When you came in here, you were pretty down, weren't you?
Oh yeah, extremely, and had a bad attitude, I guess you'd call it, you know.
Yeah. Just because of the pain?
Right, and that I couldn't work, you know, because I've always been a workaholic all my life.
Uh-huh.
And I got, the pain was so bad and everything that I got to drinking pretty heavy also.
Yeah.
And I never did get on drugs or anything, but I was drinking awfully heavy, and then I couldn't ride my bike anymore. I couldn't do a lot of things, you know, so therefore I wasn't doing anything, and the depression, you know, they set in to where I was in real bad shape, you know.
We were real concerned about you.
Right, yeah. Because I was thinking about suicide awfully bad, you know, a lot, and till one day you looked at me and said, "Ted, you're thinking about suicide, aren't you?" And that's whenever I broke down, you know, because I don't think that if you hadn't have noticed it, that I don't think I would have been here today. Honestly, don't. Because I'm not the type of person to sit around and not do anything, and if I can't do anything, well then that's it, you know.
What helped you about the program? What got you back on the right track?
Well, they started teaching me how to use the tools in a way that it wouldn't put the strain on my back. Mm-hmm. And then is to sit down a certain length of time and then stand up a certain length of time, which I have to do that today. Mm-hmm. And the chair that they gave me for my sewing machine is the best thing that I have in my shop, mm-hmm. because I sit on it. It doesn't jar me.
For me, in remembering your experience, I recall that work was the best thing for you.
Right, yeah. Because as long as I knew I could work, then I was happy.